Thank you, Dr. Mishner. Fabulous. Early intervention and taking looks. I love it. So guess who's next? Come on.
Dr. Hurley.
Oh, Dr. Hurley's next. That's right. Let's get a little energy. Everybody stretch, sit up straight in your seats. Ladies and gentlemen, Dr. Karen Hurley, she joined the Cleveland Clinic in 2016. She has over 20 years experience as a licensed clinical psychologist specializing in hereditary cancer risk. Her undergraduate degree is from Bryn Mawr College, and she completed her PhD in clinical psychology at Temple University. She is one of my favorite people in the world and a great person to talk to on a regular basis. Dr. Hurley.
Thank you. Thank you so much. So I just want to add to the memories of Dr. Eng. When I came to the clinic in 2016, she was really instrumental in making me feel not only welcome, but valued, in that she probably more than most of the, among physicians I know, that she could combine that scientific curiosity and that ability to analyze a complex technical question and explain it very simply, and then turn right around with that compassion for what does it mean to live with this condition? What does it mean to have these medical problems affecting not only you, but your family members? And welcome me fully to the table and incorporating feedback on how people were doing and their quality of life, and bringing that into the formulation of how the team was going to approach this patient. And then I also have a personal story that I wanted to share, which is part of my fondness for her. Dr. Peterson, who unfortunately went to get a snack, so she won't get to hear this. But Holly gave me a heads up when I was coming to the clinic, because it was around the holiday season. And Dr. Ng really loved Christmas carols. And so she would have a meeting towards the Christmas break, and we were all supposed to sing. And she would actually put people on the spot and ask them to sing. So picture me, I'm moving from Manhattan. I don't know anybody at the clinic. I had not owned a car in 20 years, because having a car in Manhattan is like owning a pet rhino. There's just nowhere to put them. And then, so I'm practicing driving like a nervous teenager, and I'm practicing singing "Oh Holy Night" and trying to hit that high note so that I don't embarrass myself at her meeting. So with that, again, I want to say thank you so much for inviting me back. Oh, why is it doing that beepy thing? Yeah, can you? The one below it. Ah, there we go. Yes. So I have no conflicts, and any pictures that you see are not going to depict an actual patient in order to preserve confidentiality, and none of them are going to be of your insides. So I chose psychology for many reasons, but one of the reasons I didn't go to medical school is that I'm really squeamish. So here we go. Okay. Now, when you try to tell people what is it like to live with a PTEN mutation, and when you try to explain what are all the different things that you have to do, all the different doctors you have to see, what might or might not go wrong based on having this diagnosis, have you ever had somebody say to you, "Oh, you're so strong," right? We think, resilience is a popular concept. You can, if you Google it, you'll get promoting your resilience. But what I really wanted to do today is to talk about what does it mean when life starts piling things on your plate that no one's heard of, not even your doctors, right? and how to keep going when things are being piled on your plate. And you know how life will do this, doesn't look at what you've already got before it tries to put something else on your plate as well. So that comment about being strong usually comes from either, well, people will look at you like you have some kind of special heroic quality that you were born with that lets you get through things that they couldn't imagine doing, or that somehow you have some kind of special magic, you've been, given extra tools or powers or something to get you through. But in reality, resilience is actually something that we all do. In psychology research, we know that the norm for people facing challenges of any kind is to be resilient, right? So it's a process, not an actual something that was born within you, but it's something that develops in response to a challenge. You don't see the nature of the resilience until the challenges start to come. So one of my favorite researchers in psychology defines resilience not as something special or rare, but it's an ordinary magic that comes from our human processes. So think of it this way: if you cut your finger, for example, almost right away, it starts to clot, right? And then the skin starts to reform, and within a week or so, you can't even tell that it happened. It's so ordinary, we don't think about it, but when you do stop to think about it, it's kind of a magic, right? So we have several things within us, not just these physical healing abilities, but we do have mental healing abilities that come on board in the face of challenge that we don't know exist until we need them. So that's just a different way of saying what I just said. Thank you. So let's talk a little bit about the challenges. One of the things that I've really learned in doing this work is it's important to name what the challenges are, to be specific. If you're going to be heading out into a difficult situation, you want to know the terrain. What are the ups? What are the downs? Where are the pitfalls? So what I want to do now is describe, we know that living with PTEN mutations is hard, but let's say a little bit about how, so that we can really match the resilience processes to what is actually being put in front of you. So first of all, the genetics of PTEN is centers around randomness. So when we talk about passing on a mutation, if you've got a PTEN mutation and there's a 50-50 chance of passing it on to a child, science at least cannot explain whether that's a yes or a no, right? It's truly random, a flip of a coin. And it goes against our beliefs of fairness, right? To say that something so important as the future of your child's life and the path that they may be asked to walk is essentially a flip of a coin. Now that's the science. You may have spiritual beliefs or beliefs about fairness in the world, but then that can be challenged when you see the extent of what the challenges of living with PTEN can be. Especially with PTEN mutations, there's such a wide range of what can happen, right? When we've been hearing a lot about the risks of different kinds of cancers, all in these different percentages. And these cancers are ones in organs that don't seem to be related to each other. You have to see a different doctor for each one. And at least at the clinic, they're not even in the same building, right? then we also can have, but then there's equally the risk of autism, right? And so, and again, they don't seem related to each other. And then trying to explain to someone else the fact that, that all of these are put on the table, right? And then also, what I've been learning in doing psychotherapy with people, I mostly work with adults. So I might be working with someone who's had cancer or is learning about their cancer risk. And what I've noticed is that even if they don't have a diagnosis of autism, there's still a little bit of a something, right? And I was having a conversation with one of our attendees last night where we were talking about the autistic spectrum, right? That it can go from very severe to mild. So if you think of the spectrum of light from red to purple, but on both sides of the spectrum of light, you have infrared or ultraviolet, things that can only be detected indirectly. And so similarly, I think that there are effects that are outside the autistic spectrum, but that still reflect something going on in the nervous systems and then in the development of people who otherwise do not carry that diagnosis. Little quirks of speech, little things that are hard, that seem a little harder than for people who are neurotypical. Maybe it's a slight difficulty in describing emotional experiences, or just being a half or a quarter of a beat off in social interactions. And that can have an effect of putting in a slight degree of difference that's not big enough to be named, but that still plays out in social situations. So I think the most important thing, though, is that we're talking about two different things, cancer on one side and autism on the other, and both of these are very feared when you bring them up. People, who aren't living with this will have strong reactions. And so to have to bring both of those up and keep both of those in mind in some way, again, can be an isolating experience where people can't imagine having to live in that space. So we've been hearing a lot about percentages. A lot of the things that were talked about all morning long were your chances of this, chances of that. Nothing on this was 100%, right? But when it comes down to a diagnosis, it all of a sudden doesn't matter anymore what the numbers were. You're that one in 100, that one in 1,000, whatever it was, it's now directly on you. And that can be isolating in a different way. We've also heard the metaphor of the roller coaster, something we usually get on for, at least for some people, they're fun, right? But the experience of the ups and downs of, oh, it's probably nothing. Oh, wait, maybe it is a something, right? And having that wait in between, or having to be told that, well, maybe there's something we can do for you, but turns out the effects are going to be so hard that maybe it's not something that you want to do. So this intense series of ups and downs creates a sense of wear and tear over time. There's an expression in medicine called the diagnostic odyssey, which means that sometimes you'll have a doctor who's on the up and up and recognizes signs, some of the different kinds of things that can indicate that there is a P10 mutation operating. But some patients will go through months or years trying to advocate for themselves or their child, saying, there's something wrong, there's something wrong, things are not fitting together. And you've probably all been through the experience of you walk into a doctor's office and they say, you have what? They're telling you what? That seems drastic. That doesn't make any sense, right? And so that's one of the reasons that coming together today like this and to bringing patients together and bringing experts together so that we can cooperate in educating the larger medical community. The other thing, though, from a more psychological perspective, if you finally get to one of the specialty centers after having months or years of going to doctors saying, oh, it's nothing, or that doesn't make any sense, you may have difficulty reestablishing a sense of trust because you've been through so many different experiences that undermine trust. So I think one of the challenges in bringing people together around P10 is precisely the fact that there are so many different paths to discovering that this is part of your life. For some families where it's a de novo mutation, and so it's the gene mutated on itself for the first time. It means maybe it was a child who was diagnosed with autism, and then you get that spiral from there of, what else might be going on, versus somebody who may have had lumps and bumps. I just did that. Okay, lumps and bumps that are not explained, and then they get a cancer diagnosis. Without, and maybe even others in the family haven't had a cancer diagnosis, right? But then there's that cascade of recommendations. Okay, we're going to treat your cancer, but now that we've found this mutation, we want you to see 6 different doctors, and you haven't even finished your cancer treatment yet, right? So it's almost like a landslide. The other thing I wanted to remember to say, and this came out of another conference I was at recently. You've heard us talking about Lynch syndrome periodically, which is another genetic syndrome where there are several cancer risks that all come together. It doesn't have the autism piece. And there were, I was doing a workshop on caregiving. And one of the mothers in the group said, I've got a husband and I've got 2 kids who are all mutation carriers, who all have Lynch syndrome. And even though everybody's fine right now, I know that sooner or later I'm going to be a caregiver again. This is another condition within genetic families that doesn't have a name. There are some organizations that will take people who know they have a mutation that causes cancer, but they haven't had cancer yet, and they'll call them previvors to try to capture that sense that this is a something that you're living with, even though you haven't survived cancer. So we were trying to say there's no sort of pre-caregiver name to name this state of living in tension, thinking that something might happen to somebody you care about. So what do we do in the face of this? So first of all, this is some of the sort of less helpful advice you might get. Has anyone ever cornered you and said, well, what you really need to do is stay positive, right? Because it's all in your mind, it's mind over matter, and if we could, give you an injection full of hope, we wouldn't hold that back from you, right? So, but the pressure to stay positive can actually have things. Hallelujah. But our brains make that shift, right? It's part of it's something our brains naturally do. It's not special, but it is kind of magical, right? And it doesn't mean that you get over it or that it gets behind you. But the idea is that the stuff that you can't do shifts more to the background, and the stuff that you can do shifts more to the front, becomes more of a priority. And that's the rebalancing that happens to create resilience. So what else can you do? I like to talk about activating the positive self-coach. So you can say encouraging things to yourself like, let's take things one day at a time. Looks great on a coffee mug, but when you're waiting for scary test results, this phrase takes on new power. The important thing is to find things that you can say to yourself that are not overly positive and not a pat on the head saying everything's going to be fine, because we know percentage-wise, maybe things are not going to be fine, right? But we have to be able to say things that are real and true that actually activate that sense of what can you do to get through to the next thing. There's another thing I like to talk about, which is playing your high cards, which means taking any existing talents that you already have and repurposing them. This is going to vary individually from person to person. So I had one patient who was talking about being anxious, and what does she do when, how does she get over being anxious when she has medical appointments? Turns out she was a dancer. And she used to do salsa dancing, where you have to, spin around really fast. And you have to learn how to not be dizzy when you do that. You spot, right? You put your head here. I'm not going to do it. But, and then what we said is that the mental equivalent is find something to put your attention on that you can spot around. And she has a body memory of how to do that. So that becomes part of her resilience, which is going to be different from somebody who can't do that. And so, so that's always an interesting part of therapy, is to start to find what are those talents and abilities that we can repurpose. The other thing is that's something that our brains do is anything that we practice becomes easier over time. This is a photo of the interior of a Model T Ford, right? So can you imagine getting into one of these the first time and you're going to drive it? It's like, you want me to put my feet where? I'm going to pull which lever? That doesn't make any sense, right? And you have to talk yourself through each individual action in order to get there. But eventually, there's like a smoothing process. It's a changeover that happens. And then it becomes not this lever, that foot, it becomes drive the car, right? So anything that you're not used to, like putting attention on yourself or pausing to do a relaxation exercise, anything that feels awkward at first is going to become easier with time over practice. If you show up and practice, the smoothing process happens because it's just something our brains do. So we are almost at time. Can we do a time check? How close are we to lunch? Am I over yet?
Very close, but probably the next 5 minutes.
Sure. Yeah, I got that. Okay, so these are a couple of techniques that I'd like to call emotional first aid. These are things that you can do without a lot of practice, but that can help you in specific situations. So we'll just do this one right now. So if you are having lots of anxious worries and you can't break the worries up in your head, look around the room right now and name 3 things that are blue. Right, so just spot 1, 2, and 3. Now name 3 more things that are not red. That second one's a little harder, right? What do you notice? Right? The extra activity of taking information and then manipulating it is enough to provide a little bit of effective distraction. This is a great one to do in the waiting room. Nobody will know what you're doing. You're kind of looking around, and that's it. But it's not going to take all the worry away. But then it opens that door, and then you can say, oh, yeah, I remember that Dr. Hurley said, be a positive self-coach. And then you can remember, take one thing a day at a time, and opens up that little space. And with practice and rehearsing, it becomes a 1-2. You don't have to talk through each individual part of that. Reducing hassles, anything that you can do to simplify routines that have nothing to do with your medical care actually help with reducing your overall stress level. So I always give the example that, with a busy schedule and travel and whatnot, I have 5 pairs of identical black pants. Here they are, right? That means that when I'm packing or we're trying to get dressed in the morning, grab pants, put a top on, everything's going to match. It's one thing that I don't have to think about. It's reducing my stress level, just that little bit. It's really important to have respite, especially if you're a caregiver. Those little breaks in between will make or break you in terms of, again, it's our physiology. If you try to push through without taking breaks, that adds to your stress level. It actually increases your vulnerability to stress and burnout in the long run. An example I like to give for this one is, the Indy 500 race, where the cars are going round and round and round. No one can finish that race without at least one pit stop. And so no matter whether they want to take the pit stop or not, they have to in order to complete the race. Okay, I'm going to skip ahead here. So I think really, with all of the different impacts of P10, the thing that really brings us together is not just bringing together the P10 community, but bringing us together as humans, right? Which is that we all face these basic conditions, that we're all subject to random events, not just people who have mutations. We all have less control over life than we want or think that we do. And we are all mortal, as we're all very poignantly aware of in missing Dr. Ng today. Oh gosh, I'm gonna get a little teary. So these genetic conditions like P10, with all of these extra challenges, push you to a place where you're aware of these facts of life, more than the average person who isn't having to sit through, 5 talks in a row that all talk about, mortality rates. Okay, right, we get it. We're all mortal, right? But the antidote for this is being able to connect to the things in your life that are important, that are meaningful, that keep you connected to other people in spite of the isolation that can be imposed by having something so rare, to bring you together, to be able to put together a life that is meaningful and full, and having a good day within reach. And I'm going to end, Kristen asked me to talk about, make that extra plug for the importance of research. I am here and grateful due to the women who, 20 years ago who participated in clinical trials for Herceptin, right? I'm going to get emotionally. HER2 positive cancer used to be one of the worst diagnoses, and now it's much more treatable because women stepped forward, participated in these trials, and now there's a drug that's effective that didn't used to be there. So I have 13 years of extra of life that I'm very grateful for. Thank you. And hoping for many more. And I appreciate the opportunity to use my life well and fully in service of this community. Thank you so much.